Thank you, Mr. Chair and members. Good morning. I'm pleased to be here as you consider the repeal of Alberta's Voluntary Blood Donations Act, and I value the opportunity to communicate our concerns with this potential action and our thinking on commercial plasma collection in Canada, particularly during the COVID pandemic. As the committee has noted, the blood and plasma system in Canada and the emergence of commercial plasma collections are complex issues with national and international contexts and ramifications. Globally, there is a shortage of plasma used to make special plasma-derived therapies. It existed pre-COVID, and it's exacerbated by the impacts of the pandemic. All countries, and both the public and the commercial sectors, need to collect more plasma. The issue at hand is how we best ensure domestic security of supply in light of this growing shortage. And we do not believe that the repeal of the Voluntary Blood Donations Act addresses domestic security of supply. Recognizing the complexity of the issue, I will explain why and how we need to address this and best protect supply for Canadian patients. Firstly, the majority of commercial plasma collection industry is vertically integrated with the fractionation industry. In other words, the raw plasma from these for-profit entities is directed to their own manufacturing sites where it is fractionated into plasma-derived therapies. These drugs are then sold on the international market. CBS buys many of these finished drugs through public procurement processes. Secondly, there are a limited number of collection firms that are not vertically integrated with fractionation entities. One such operates in Saskatoon and Moncton. Commercial plasma collectors, whether vertically integrated with fractionators or selling the plasma to them, do not serve domestic markets. They serve global plasma therapies markets from which we and others procure finished goods. CBS, on the other hand, has a clear mandate from government, supported by long-established ministerial principles to ensure security of supply for patients in Canada. So how do we do that? Our approach is based on diversification, risk mitigation, and cost efficiency, and recognizes and enables roles for both the public and the commercial sector. The first component of our approach is our plasma collection business. We collect plasma from non-remunerated donors, and we have it manufactured into specific therapies licensed for exclusive use in Canada. Let me emphasize, we do not sell our plasma. We have it contract manufactured into finished drugs for use exclusively by Canadians. Secondly, as part of our risk diversification strategy, we purchase finished plasma therapies and distribute them to hospitals across the country. Having plasma therapies sourced from both the non-remunerated and the paid plasma sectors is not contradictory, and it is certainly not hypocritical. It is prudent risk diversification. I hope this clarifies that CBS is not against the commercial plasma industry. We, like others, recognize that patients in Canada and globally rely on the commercial industry for needed medications. We all agree that we need to collect more plasma in Canada to enhance domestic security of supply. CBS has a sound plan to do so. We are opening 3 dedicated plasma collection centres in the coming months, including one in Lethbridge. These centres are the beginning of a needed program to substantially grow domestic security of supply. We are confident in our operating model and have committed to our funding governments, including Alberta, that we will collect a litre of plasma at a price that is proximate to the large-scale commercial market. The appearance of commercial for-profit plasma collection in Canada has created much debate and divide over the last few years. Indeed, it is a new dynamic and a potential paradigm shift for the country. It is appropriate, then, to assess what this could mean for the national blood and plasma systems and examine the potential impacts and implications for security of supply of both blood and blood products. CBS has been calling for a discussion with health ministers so we can collectively reach a consensus on the risks and how best to mitigate them. Large-scale commercial expansion of plasma collection without adequate controls is a major concern for the integrity of the publicly mandated system and the patients it serves. We have consistently maintained it is not our role to tell governments how to legislate. It is our role, however, to provide advice. I'll be 1 second, Mr.
You
Chair.
want to finish your thought.
It is our role to provide advice as the National Blood Authority on the impacts of changes to legislation. In this context, then, we are not neutral on the repeal of the Voluntary Blood Donations Act. Without the dialogue and the resolution we've been calling for, I cannot definitively say that repealing this legislation will not harm the voluntary collection system that governments have invested for decades. I can say, however, that commercial plasma collection without controls will not address domestic security of supply. Thank you for your time, and I apologize for going over.
That's so good. Thank you very much, Doctor. Appreciate the presentation. We'll now go to the official opposition, and I see Member Hoffman. Go ahead.
Thank you very much, Dr. Scher. And I'm going to try to keep my questions very brief in an attempt to hit as many topics as possible. But first, can you talk about Alberta donations as a percentage of the overall Canadian donation system? We're about 10% of Canada's population. How are we doing in terms of the donor population?
Alberta is actually a larger contributor to the national pool of blood donations than its population. Our largest blood collection centre in the country is here in Edmonton. We have a very large one in Calgary. We're opening a plasma centre in Lethbridge. We have a blood centre in Red Deer. We also have the second largest manufacturing and testing facility in the country, just opened up in Calgary, one of the largest and most modern blood manufacturing facilities in the world. Alberta is a tremendous contributor to the voluntary blood system in this country and always has been.
Thank you very much. And for my supplementary, I'm hoping I can talk a little bit about Lethbridge, the expansion on Lethbridge. Can you tell us basically how much money has been invested in that initiative, how many jobs you expect it to create, and generally how many jobs there are in Alberta, given that it's such a large donor base?
Well, cumulatively, CBS has over 600 employees in the province of Alberta. In Lethbridge, what we're opening up is one of 3 standalone dedicated plasma collection centres. The other 2 are in Sudbury, Ontario, which is actually opening in about 2 weeks. Lethbridge is opening in December, and then we're opening our 3rd one in Kelowna, British Columbia in March of next year. The purpose of these centres, Member Hoffman, is to exclusively collect plasma. They will not be collecting any blood, and that plasma will be exclusively sent to our fractionation partners and made into drugs returned to us for Canadian patients. These 3 centres are the first of many that we need to expand in this country, and it's been our commitment to governments that we will demonstrate through these proof of concept collection centres that we can generate plasma collection in a way that is equally efficient and essentially price proximate to the large-scale commercial market. Each centre, including Lethbridge, will be generating about 20,000 litres of plasma per year. We will be employing about 12 to 15 staff members, a variety of nurses and collection staff and logisticians, which is really what you require to run a plasma collection centre. And all of the plasma collected from those sites and our other sites across the country go then to our commercial manufacturing partners, of which we have 2.
Thank you. Mr. Yao, go ahead.
Thank you so much, and thank you for being here, sir. International companies are being disparaged heavily by all the folks that are against me repealing this bill. They refer to international blood brokers. They talk about exporting overseas. They talk about Mexican blood. Bloodwatch mentioned that I have a specific objective of selling our Canadian products to China. And I won't get into the underlying tone there, which I find disgusting.
Mr. Yao, just a question for the guest. I appreciate that.
CBS, can you explain how Canadian Blood Services, do you guys deal with any of these international companies, or can you explain to us the international market around who's producing these medications, if there's any other use other than medications for a lot of these issues? And I was wondering if you can also mention anything about the opposition mentions, and some of the stakeholders mentioned lowered rates of uncompensated volunteers are affected in Saskatchewan, Manitoba, and New Brunswick. Can you clarify that is a true statement that they're saying?
Thank you, Member. Yeah, a couple of quick responses. So firstly, Canadian Blood Services has never said anything disparaging about any international companies. We partner extensively with them, as I mentioned. The plasma that we collect, we send to 2 of these large-scale commercial fractionators under contract. They take our plasma in a dedicated line, they fractionate it and return the finished goods to us for exclusive distribution to Canadian hospitals. We have been in a multi-year relationship relationships with those countries. And then we also purchase on the international market from these and other commercial manufacturers the additional products needed for patients in this country. So, as I've said, the patients, and you've heard this from many of the patient groups around the world, rely on a combination of plasma collected both from the voluntary sector and the commercial sector, and the manufacture of these drugs by the commercial sector. In terms of your question around the effects in Saskatchewan and New Brunswick when Canadian Plasma Resource opened there, we have commented on this multiple times in the past. When they first opened in Saskatoon, we did notice a drop in our collections, particularly in the 17 to 24 age demographic. We were able to rebalance that, and to date we do not see much of an impact there. I have to point out that this is an exceedingly small plasma operation, and we've always consistently said we are not concerned about one or two small plasma collectors. It is the rapid expansion of the very large-scale commercial plasma industry that absolutely does have the potential to encroach on the voluntary blood sector. And in fact, the two largest blood centers in the United States, the American Red Cross and Vitalant, their chief executives expressed grave concerns about the rapid expansion of the commercial plasma sector and the impact on their collections as blood operators, and we'd be happy to put the committee members in touch with those blood executives.
Thank you so much. There's an underlying tone that we ultimately wish to be self-sufficient here in Canada, to create our own supply, to create these medications here. I think everyone agrees on that. It's just the objective how we get there, whether we allow other companies to do it. But there are some companies in Canada that are providing or collecting plasma. Does Canadian Blood Services purchase this product from these groups, knowing that it is ethically accessed compared to, say, Mexican blood that was mentioned earlier by Bloodwatch? I mean, is there, what are the concerns here, in your opinion, on how we can be self-sufficient? And Canadian Blood Services, over 10 years ago, you had an objective of being self-sufficient in plasma collection. What were the end results of that? Where are we at today? And do you feel, recognizing we've had the status quo for over 2 decades, that perhaps we need to reconsider some alternative solutions in order to ensure Canada is self-sufficient?
A fair number of questions in there, Member. Yeah, I'll be brief. So let me clarify on the purchase point. We do not purchase plasma from anyone. We don't buy Mexican blood, or we don't buy plasma from the large commercial plasma collectors in the United States. We buy the finished drugs that they manufacture. We send our plasma for manufacture, and we buy additional drugs manufactured on the commercial market. We don't buy raw material plasma. So no, we have not bought the plasma from that entity in Canada that you referred to, and I also will repeat myself, they have exquisitely small volumes that have essentially no meaningful impact on the domestic sufficiency. In terms of the sufficiency number, you are correct. This has been a long journey in Canada. Going back 20 or more years, there was the ideal that Canada should be self-sufficient in plasma for the purposes of making these specialized drugs. About in 2009, we actually worked with patient groups, clinicians, governments, many other stakeholders, and we determined that at that time the best sufficiency level was around 40%. You wanted to have about 40% of your immune globulin made from our plasma and about 60% of it purchased on the global market. That number has shifted as we've diversified our risks in different ways by bringing second fractionators on board and other risk diversification strategies. And in the last few years, we've been working with the provincial and territorial governments to expand our plasma collection network. It's taken a long time to get the approvals, but now that we're underway, we are very confident we will reverse the decline in sufficiency and begin to see significant upticks in domestic sufficiency, which is really our mandate and our objective to meet the needs for Canadian patients.
Thank you. Member Hoffman.
Thank you very much. I appreciate that, because the security of our domestic supply and the stability of it, I think, has been highlighted, particularly during the current pandemic. So I'm wondering if you can speak about impacts to the volume of voluntary donations, what you anticipate they would be with regard to your goal of hitting 50% domestic donations for voluntary plasma here in Canada.
So, Member Hoffman, if I understand the question, one of the cardinal features of Canadian Blood Services being able to control both the blood collection and the plasma collection is that we can mitigate the risks of any potential expansion in one part of the collection environment on the other. So, for example, when we're opening up our plasma centres in Sudbury, Lethbridge and Kelowna, we are doing that in a very considered way that it will have no impact on our collection of blood in those regions, because we control a fully integrated supply chain, and we can develop donor bases to serve both the plasma and the blood collections, and we can make sure that we don't essentially rob Peter to pay Paul. An unbridled commercial collector that doesn't have that focus on the blood sector will and almost certainly can have a negative impact on blood collections, as we've seen in places such as the United States and Hungary and elsewhere. And that's the concern we have about this repeal of the Act. It doesn't focus on the issue of retaining domestic security of supply, which is essentially the mandate of our organization. It's not that we're against the commercial sector, and it's most certainly not that we're against the notion of paid or unpaid donors. That's not what this is about. This is about who can control and what are the conditions that need to exist, that if there is expansion of plasma collection in this country, it happens in a way that mitigates any impact on the voluntary non-remunerated blood sector.
Follow-up, please.
Yeah, so just to be crystal clear, it's, I just want to understand, it's your opinion that if this bill were to pass, that it would threaten the security of the domestic supply chain here in Canada?
As I've said in my closing remarks, I cannot say with certainty that if this bill passes and the legislation is repealed and there is rapid and expansion of the large-scale commercial collection, plasma collection industry, that won't have a negative impact on the blood sector. I am concerned about this. My colleagues in the United States are seeing that impact and expressing grave concern, and I think it's something we would need to be highly vigilant of without adequate controls and guiding mechanisms to prevent that from happening.
Mr. Sigurdsson, go ahead, please.
Sorry, thank you, Doctor, for spending the time today and come and provide us a little bit more information on this. One thing I want to touch on, because you mentioned that I think was a powerful statement, that the blend of both voluntary and non-voluntary is prudent risk mitigation. And I guess I just want to ask a question when it comes to that, this little bit of the supply chain. And why does CBS purchase U.S. plasma but doesn't purchase Canadian plasma from Canadian companies such as the Canadian Plasma Resources?
Thank you, Member Sigurdsson. It's because it really isn't. Your question is an important clarification. So if I didn't say it clearly enough, I'll say it again. As you will in fact hear from Dr. Jaworski in a minute, the assertion has been made that it's hypocritical on our part to purchase finished plasma drugs from the commercial sector, which pays its donors, and yet for us not to pay our donors. And that's what I said is neither hypocritical nor contradictory. It's prudent risk management. We don't buy plasma from anyone. We buy finished product from the commercial markets, a plasma that has been made into these specialized drugs, or we take our plasma and have it made into specialized drugs. And so what we're doing for Canada in that way is essentially providing a balanced security of supply to our supply chain. So should there be a disruption in the commercial manufacturing sector, or should there be a disruption in the Canadian plasma collection and contract manufacturing, we have diversified our risk strategy. So that's what I'm saying, and I'm saying that because the assertion has been made that we're against the commercial sector. We're not at all, as you've heard from all the patient groups, and we completely agree with them. Without the large-scale plasma collection industry globally, there wouldn't be enough products around the world for patients. What we're seeking to do is protect domestic security of supply, which currently is only around 14%, and we believe needs to be closer to 50%. And that is achieved by the public sector collecting more plasma in this country and then having that plasma manufactured into these specialized drugs, as opposed to outsourcing the collections to the commercial industry that would essentially then deliver those products to the global market. It's not an unlaudable thing what they're doing globally, but it doesn't protect Canadian patients and doesn't serve domestic security of supply. So
follow up, please.
And I guess that's really what I'm trying to hit on right now, because a previous member had stated that CBS has the ability to bring the product back. You've established that you can through your voluntary. And I guess when you're talking about that diversification, which provides that security, and we're looking at only supplying 13.5% of what we have right now, and we are importing a lot from paid donations. I guess my question really underlies the fact that increasing collection in Alberta here would potentially allow CBS the opportunity to contract with Canadian companies further in order to build that diversification and secure a better domestic supply, because the voluntary increase right now seems like we're not going to get to where we need quick enough. So I guess is it potential that you can enter into Canadian companies, contracts with them, to be able to keep a diverse system here with those private companies and guarantee that they bring it back?
Exactly, Member Sigurdsson, and that's why we have been urging governments to hit the pause button, and we're concerned that rushing this repeal through doesn't allow for precisely that conversation that you're identifying there. If there is going to be commercial collection in this country, what are the ground rules and the mechanisms that need to exist to prevent that, one, from harming the blood system, and two, from not seeing that plasma leave the country? None of that is addressed in Bill 204, and that is part of our concern.